The people I'm seeing are so much like you and I. Most of them have had really good paying jobs. Some of them are in between, some of them are highly educated. I had a fellow in the other day working on his master's degree. Unable to find a job at that moment, no health care and health care needs. Or accidents like this woman with the stroke. I mean, all of these things are out of people's control. And I think any one of us could be in that situation overnight. We could get laid off, lose our jobs, whatever it is, be without health insurance and suddenly no longer have the resources to pay for health care.
Do we let these people fall through the cracks of our health system? Do we make preventative care beyond their reach, causing health problems to go untreated until a trip to the emergency room is the only option? Causing a greater burden to be placed on our already stretched healthcare system? Or do we help our friends and neighbors stay healthy, productive members of our community? Studies show that if the uninsured had better access to health care, their annual income would increase by 10 to 30%. Think of the way that this would benefit our community. Today, the uninsured of Watertown must go to Oconomowoc or Jefferson to receive treatment. These clinics cannot see everyone who needs help. They have pledged their support to get the Watertown Clinic off the ground because they have seen the need in their clinics every day.
More towns should have them. I know that people come from far and wide to come to this Jefferson clinic, and there's a list and people just line up for hours. And sometimes you're there from 2 in the afternoon waiting to get in line until 8 or 9 at night, and then you're not even seen. You're still sent away, and there's people who have a lot of needs and aren't being seen and taken care of from other towns.
Including myself, there's a lot of people from this area that use the clinic, and it's hard for them to get down there, especially me. I don't drive, and for me to get down there once a month for the diabetes clinic, it's kind of tough.
We do our best to connect them to other resources, and sometimes it works and sometimes it doesn't. Often individuals struggle with trying to get transportation to resources outside of Watertown, and they don't follow through, they're not able to. So they may come back in the future and have their whatever health condition they had come in originally seeking help with has it been exacerbated, or the symptoms have increased, and now they are in urgent need of health care.
Already over $40,000 has been raised. Organizations like Watertown Area Health Services have pledged support in establishing and sustaining this clinic. The City of Watertown and the Mayor have pledged their support. Many citizens have given of their time and talents to make this dream a reality.
Right here before me on my desk is I'm working on the 2008 city budget. I have told Carol Quest, our city health official, that I am going to do the utmost that I can to have the city participate. And I would hope that every business in the city and community organizations would get behind support for the Community Cares Clinic. It's vital, and it's a lifeline for many citizens that just have no place else to go. So it's such a worthwhile effort that I believe we should all be behind it.
I really, truly believe that our credibility as a community, our growth, depends on making us stand out as leaders in the state of Wisconsin for communities our size. When I look around the area, even in southern Wisconsin, we have a great opportunity here to show that we can manage our population of health, whereas many communities don't.
I'm not sure who said it anymore, but it takes a village to raise a child, and it's the same with the medical needs of a community. You know, how do we help? This community has done things like fundraisers for very sick children, and we have Relay for Life. Most communities have that. When we embrace it as a group, we do a lot better. We can reach more people. We can reach out to those who might not traditionally come to a clinic. I never saw myself coming to a clinic, and here I was in my need, and was able to do that because it was there. without it being there, where do you go?
I try to encourage people who hear about our project, who are interested in our project, that's an important reason for them to be involved, to volunteer or to donate time, money, efforts, skills to our upcoming free clinic, is to help the community overall, help these people who don't have access to, or don't have insurance, don't have access to care, help them get some access to care so they can remain productive and healthy and happy in our community.
A location in the Health and Wellness Center will soon be available. A clinic coordinator is in place, and many local healthcare providers have pledged their time. What is missing is you. Can we count on your help? Monetary gifts are badly needed to reach our $120,000 startup goal. Once the clinic is established, funding will be needed to meet day-to-day operation needs. Volunteers are also needed, whether to work in the clinic or to use your talents behind the scenes. All we need to make this a reality is you. In every community, there is work to be done. In every heart, there is the power to do it.